The skill I want to look at now is taking blood pressure. This is something we do with virtually every patient we meet, whether it's in the GP practice or in the community at home or in the hospital environment. So for taking blood pressure, you need two things. You need a stethoscope and a sphygmomanometer, otherwise known as a sphig. It's easier to say that. And we also have a patient here, Mary, who's very kindly agreed to let me take her blood pressure. Mary, have you had your blood pressure taken before?
I have.
You have, so you know what it's like?
Yes.
And is it okay if I go ahead and do it now?
That's fine.
Great. So what have I done there? I've checked with Mary that she's had it done before, and I've also asked permission to go ahead and do it. Okay, so the first thing I'm going to do is put on the sphig. Now, the sphig consists of a cuff. This is the cuff, the reading manometer, and the pump. So we'll just put this on your arm here now. I'll put my glasses on first, that's very important. Okay. And then did you slip your hand down there? That's great. Okay, and I'll put it over here. So when you look at the cuff here, you'll see that there's two markings on it here. You have left arm and right arm. And the idea of these is that this should be over the brachial artery. And the brachial artery runs on the inside of the arm here. So we're going to place that around there where the brachial artery will be. Okay? And then you put this around, holding it there, and put it on relatively comfortably tight. Okay? With the leads down for this. This is the reader, which I will look at later on. I'm just going to put it down there for the moment, and you can just rest your hand here, okay? Now, I'm going to feel for Mary's radial pulse here. And I have it there, and it's a nice, strong, even pulse. Now, when you feel for the pulse, it tells you a lot about the patient. It tells you the degree of fitness, the rate, the rhythm, and the volume of the pulse. Now, I'm going to close the valve here, and I'm going to pump this up until I lose the radial pulse. It's still there, and it's still there, and it's gone now. So I'm going to open this up again. Now, the reason I did that was to find out what was the systolic blood pressure. Give me an idea of what the systolic blood pressure, so that I know how high up to pump this. So this went out at 120. That's where I lost her radial pulse. So I pump this up to 120 plus 25/30. So I'll pump it up to about 145. And that allows me to release the air and to hear the pulse when it comes back in with the stethoscope. So now I'm going to put on the stethoscope. So now, with her arm like this, I'm going to feel for the brachial pulse here. Okay, and it's there, and it's very strong, and it's even. So I'm taking a visual of where it is, and I'm going to put the stethoscope over that area. You all right there?
Yep.
When I put the stethoscope on, be careful not to hold it with your thumb, because you have a pulse in your thumb. So hold it with your other fingers like so. And I'm going to pump this up now. So you feel a little bit of tightness in your arm. All right. And I'm releasing the valve now. And that's lovely. Okay? That's very good. Now, when I pumped this up to, I pumped it up to 140, which was here. And then I gradually released this. Now, the easiest way to release this is to hold the ball of the pump in your hand, and between your thumb and your forefinger, hold the valve there. And it is best if you continually hold the valve. Don't sort of release it like that, because that leaves the needle here will jerk on you. So just hold it like that and gradually release it, and the needle will come down at an even rate here. Now, what you need to watch for on this is when you hear the first sound of the pulse, you take a reading from this here, and that's your systolic blood pressure. And then you listen, and it'll go vroom, 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 vroom. And then you'll notice that it goes, this is generally what happens, it goes vroom, 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 vroom. You want to take the last vroom, which is usually the quietest one, and that is your diastolic blood pressure. Now, Mary's was 110/70, which I would say is a very good blood pressure. and you record that on the patient's notes.